session. And I'm going to share with you my screen in a second. Okay, guys, if you remember, this is the heart. This is the heart, and you have, first of all, you need to remember the most important great vessels. Then you have, guys, arriving into your right atrium. Remember, the outer part is called right auricle because it seems like a dog ear. Then arriving into the ventricle, the right atrium, you have the superior vena cava. Then the superior vena cava is going to be this one. And arriving into the right atrium, you're going to have the inferior vena cava as well. Then you're going to have two inferior vena cavas arriving into the right atrium. You need to know these names for sure. Arriving into the right atrium, you have another vein, which is the coronary sinus, and that is from the heart. Departing from the right ventricle, you have the pulmonary trunk. And then you have two arteries, the left pulmonary artery and the right pulmonary artery. As you can see here, all of it is the pulmonary artery. Then you have again the pulmonary trunk emerging from the right ventricle to the left side, left lung, and to the right lung. Okay, guys. Then we have the most important artery in your body, which is the aorta. Remember, the aorta is the most important artery in your body. Then you have the aorta, and the aorta is right here. This is the aorta. And you have three portions in your aorta. You have the ascending portion, you have the arch, the aortic arch, and then you have the descending portion, which is going to be behind the heart. Then you have the two first branches are the coronary arteries. It's going to be left side, left coronary artery, and right coronary artery. These are the two first branches of the aorta. Then you have three huge branches of the arch, of the aortic arch. These are the brachiocephalic trunk, the left common carotid artery, and the left subclavian artery. And this is really important, guys. On the right side, you're going to have a common trunk, and this common trunk is called brachiocephalic. And from here, you have two more branches, the common carotid artery and this right subclavian artery. On the left side, you don't have brachiocephalic trunk. You have directly the left common carotid artery and the left subclavian artery. They are the same, but here we have a trunk. And then you have the descending portion of the aortic, the aorta. Guys, arriving into the left atrium, we have four. 1, 2, 3, 4 pulmonary veins, and they are carrying oxygenated blood from the lungs into the heart. Again, we have 4 pulmonary veins, and they are carrying oxygenated blood from the lungs into the heart, arriving into the left atrium. And finally, we have emerging from the right ventricle, the pulmonary trunk, and we're going to have left pulmonary artery and right pulmonary artery. Guys, these are great vessels, and you need to remember all of these blood vessels. The second group, I'm going to show you guys, these group of arteries are branches of the aorta. Then you can see here, this is the ascending portion, this is the arch, this is the descending portion. For the aorta, you have two big portions. Here, if you remember, we have the division between between thorax and abdomen, we have the diaphragm. Then this muscle is the diaphragm dividing our thorax from our abdomen, and we have the thoracic portion of the aorta and the abdominal portion of the aorta. Again, we have a thoracic portion of the aorta and we have an abdominal portion of the aorta. For the thoracic portion, guys, we're going to regard in a second some arteries because we need to irrigate our ribs, and then we're going to study the branches of the thoracic portion. For our limbs, upper limbs, we use the left subclavian artery and the right subclavian artery. Then we're going to regard here some branches of the subclavian arteries for our limbs. Again, we're going to study for the ribs some branches of the thoracic portion, and for our upper limbs some branches of the left subclavian artery and the right subclavian artery. For our abdomen and some structures here, such as the stomach, the spleen, both kidneys, our liver, these are structures, our guts, our intestine, small intestine, and large intestine. All of these structures, they are fed by arteries from the aorta, but it's going to be this portion, the abdominal portion of the aorta. And finally, for our lower limbs, we're going to talk about blood vessels from the iliac arteries. Then we have the common iliac artery on the left side and the right common iliac artery. These two are for the lower limbs. Then guys, pay attention because we're going to talk about the main arteries and veins in our body. As you can see here, this is an image from the abdominal aorta and common iliacs. You can see here a branch for the liver, which is the hepatic artery. You can see here both renal arteries, this for the right side, this for the left side. You can see here the celiac trunk, which is the first branch in our abdominal artery, abdominal aorta. And this one is going to be the origin for some arteries such as the splenic artery and the gastric artery. This is for the spleen, and the gastric artery is for the stomach. Then you have some branches of the superior mesenteric artery, and it's going to be for the small intestine, and some branches from the inferior mesenteric artery, and these are for the large intestine. Then you have the common iliac arteries, and then you can see here the division. You have the external iliac artery and the internal iliac artery for each side, the right side and the left side. Remember, these two are for the lower limbs. Then you have here the branches. Again, you don't need to go in detail, but you need to memorize and identify every single big artery. Then you have branches of the aorta, right and left coronary arteries. Remember, these are for the heart. Then you have arch of the aorta. You have the brachiocephalic trunk. This is for the right side. Left common carotid, left and left artery. Subclavian artery on the left and the subclavian artery from the brachiocephalic trunk, both of them are for the upper limbs. Then you have the descending aorta, and you have the thoracic portion, and you have some important arteries. All of them are for organs in your thorax. And some portion of the abdominal aorta, remember, between thorax and abdomen, you're going to have the diaphragm dividing these two. The diaphragm is the muscle dividing our thoracic cavity and the abdominal cavity. Then in the abdominal aorta, you have the celiac trunk, which is the first branch. you have, this is important, this is important, this is important, this is important, and this is important. If you remember the celiac trunk, which is the first branch, if you remember the superior mesenteric artery, which is the irrigation for most of the small intestine, if you remember the renal arteries, two of them, one on the left, one on the right. If you remember the inferior mesenteric artery, we're going to talk about the large portions of the large intestines. And finally, we're going to have the division of the aorta at the end in two big arteries called common iliac artery, one on the right and one on the left. Guys, regarding the head, if you remember, we have two different names. On the right side, you can see here, the right side, you have the brachiocephalic trunk. On the left side, you don't have brachiocephalic trunk. You have directly a common carotid artery and a subclavian artery. Then for the head, we use the common carotid artery, and it's divided in two. This one is external, and this one is internal. Again, the common carotid artery has two branches. One is external, and the other one is internal. The external one has some branches to be irrigating your head, the outer part of your head, and you have some branches to irrigate your eyes, your nose, your mouth. All of them are branches of the external carotid artery. But you have some internal branches, some internal carotid artery, and then you have to use these ones in order to irrigate some structures such as your brain. And I'm going to show you in a minute some important arteries for your brain. And you have here an important, a very important artery, which is the vertebral artery, which is branch of the subclavian artery. If you remember, guys, I don't know if you remember, I hope you remember this. If you remember our classes about the vertebral column, and you need to remember we have 7 cervical vertebrae, and we have 12 thoracic vertebrae, and we have 5 lumbar vertebrae. Then if you remember the way to differentiate vertebrae, you remember the vertebrae in your cervical, they have holes on the sides. These two holes, these vertebral foramen, are for this artery. And we're going to talk a little bit about this artery. Then I'm going to share with you my screen again. And this artery is the vertebral artery. If you remember, it's crossing these holes from the vertebral, the vertebrae. Then you have here atlas, axis, and C3, C4, C5, C6, and C7. All of them, they are holes on the right side and the left side. And this is the vertebral artery. At the end, both vertebral artery, they're going to be together, and they're going to form the basilar artery. And it's a really important artery for your brain. And I'm going to show you in a minute why. Again, you have the common carotid artery, and from here you have an internal portion and you have an external portion. The external portion is for the external part of your head. It could be your cranium, it could be your orbitals and your eyes, your nose, your mouth. And the internal one is going to be for the internal organs, such as your brain. Then this is the most important part of the irrigation in your head, guys. This is called the Circle of Willis. The Circle of Willis. Then if you remember, I told you we have 2 vertebral arteries, and they're going to be together in one artery. Then these two are the vertebral arteries, and when they are together, they form this artery called Basilar Artery, which is the posterior part of the Circle of Willis. And then you're going to receive some other arteries, such as the internal carotid artery, giving you a whole circle. This circle is the most important circle in your brain. Actually, if you can see here, you have the most important gland in your body, which is the pituitary gland, and it's a circle around the pituitary gland. Again, this is the Circle of Willis, which is the most important source of blood to your brain. Then, guys, if you remember, I told you we have on the right side and the left side subclavian arteries. But this side on the right side is branch of the brachiocephalic trunk, and here on the left side is going to be directly from the arch. Remember, on the right side we have a brachiocephalic trunk, and here we're going to have directly a subclavian artery. Then the upper limb, you need to remember the subclavian artery, the axillary artery. If you remember, this is your armpit, your shoulder, and then this portion, it's the same artery, but it has different names. In this portion is called axillary artery, and then you need to think in this brachial artery because of your blood pressure. And you need to think in these two branches, important branches. On the lateral side, the thumb side, is going to be the radial artery, and this one is for your pulse. And another artery for your pulse, it could be the ulnar artery. Remember, on the lateral side, it's going to be radial, thumb side, and on the pinky side, it's going to be the ulnar artery. Then important here, it's going to be your subclavian artery, your axillary artery, your brachial artery, your radial artery, and your ulnar artery. These are huge arteries, guys. You need to remember these in your exam, and you need to remember this for your life as healthcare professionals. Then if we go over the thorax, we're going to have our thoracic portion of the aorta. If you remember, we have the ascending portion, the arch, and then the descending portion. This is the descending portion of the aorta, and this is the thoracic portion. And every single rib, we're going to have a branch of the aorta, and these are for our muscles and our ribs here. Then we're going to have, again, every single rib is going to have a branch, intercostal branch of the aorta. This is the abdominal portion of the aorta, and you have here a common iliac artery. Remember, you have the aorta, and then you have a division. Each of them is going to be a common iliac artery. But after that, the common iliac artery is branching again, and you're going to have an external iliac artery and an internal iliac artery. The external iliac artery is going to be for your lower limb, and the internal iliac artery is going to be for your pelvis. Then again, you have the aorta, abdominal aorta. You have the division to the right side and the left side. This is the right side, this is the left side. This is the common iliac artery. And finally, you're going to have another division here in external iliac and internal iliac. This is the external. This is going down to your leg, and this is for your pelvis. Then this is going to be useful for irrigating your urinary bladder, this portion of your intestine. If you're a woman, it's going to be useful for your ovaries, for your uterus, the internal iliac artery. And the external one is going down to your lower limb. Then important here, abdominal aorta is divided in two in common iliac arteries. And the common iliac arteries are divided in two again, external iliac artery and internal iliac artery. The internal iliac artery is important for these organs in your pelvis. such as your urinary bladder, your uterus, ovaries, testes, the final portion of the large intestine. All of them are irrigated and fed by the internal iliac artery. Then, guys, we're going to have, if you remember, the external iliac artery is going to be going down for your lower limb. And the external iliac artery has some important branches. I need you to remember the femoral artery. This is important for your pulse. And it's really, really massive. It's one of the longest arteries in our body, the femoral artery. And then in your legs, you have two important arteries, tibial arteries and fibular artery. If you remember your bones, you have the femur, femoral artery, you have your tibia, tibial artery, and you have your fibula, fibular artery. Then I just need you to remember these arteries. They are huge. I don't need to remember details. They are really, really huge. Again, from the abdominal artery, you have the common iliac one, and the common iliac one has two branches, the external iliac and the internal iliac. The internal iliac is going to be for the pelvic organs, and the external iliac is going to be for your lower limb. Then the lower limb, you have the most important arteries you have is the femoral artery, and then the tibial arteries, you have two of them, anterior and posterior. And the fibular artery. You need to remember the names of the bones in this portion. The femur has a femoral artery, the tibia has the tibial arteries, anterior and posterior, and the fibula has the fibular artery. Now, guys, we need to take that blood back to the heart because we already have blood in our head, we already have blood in our neck, we already have blood in our thoracic cavity, we already have blood in our upper limb, in our abdomen, in our pelvis, in our lower limb. We need to get that blood back to the heart. Then we use the venous system. Then we're getting that blood back to the heart. In your head, you use these sinuses. These sinuses are located mostly around your meninges. If you remember the meninges, you have the membranes around your brain, dura mater, arachnoid mater, pia mater. Then they're draining all of this blood in these sinuses. They are like lakes, huge lakes of blood, and then they are draining on a jugular system, and they are draining especially on the right and left external jugular veins. Jugular veins are these veins, jugular veins. And the internal part, if you remember the vertebral artery, you have a vertebral vein as well. You have the same system here, but these are draining in your right internal jugular vein. Then you have two jugular veins. You have the external vein, jugular vein, external, and internal jugular vein. Both of them are draining on the brachiocephalic trunk. If you remember on the right side, we have a brachiocephalic trunk for arteries, and we have the same for the veins. Then the jugular veins are draining on the brachiocephalic trunk, and the right subclavian artery is draining on the right brachiocephalic trunk as well. For draining our upper limb, guys, here it's going to be a little bit different. Why? Because we have two things. We have a superficial system of vein, and we have a deep superficial vein. The deep one has the same name you remember for arteries. If you remember, you have here subclavian artery, you have axillary artery, you have brachial, you have ulnar, and you have radial. It's going to be the same for the deep system. It's going to be, you're going to have a radial vein, an ulnar vein, both they are draining in the brachial vein, and the brachial vein is going to be draining in the axillary vein, and the axillary vein is going to be draining in your subclavian vein. It's going to be the same thing, but you have a superficial system, and it's actually more useful clinically, more useful than the deep one. Usually, you use the cephalic vein for drawing blood, or the median cubital vein for drawing blood, or the basilic vein. Then on the lateral side, superficially, you have the cephalic vein, and the cephalic vein goes from the hand to the shoulder, the whole way. All of it, it's cephalic vein, all of it, cephalic vein. Then you can draw blood from here, from the cephalic vein. Then you have on the other side, the basilic vein, and it's going to be on the ulnar side. And it's going to be draining on the axillary vein. And finally, connecting both sides, between the cephalic vein and basilic vein, you have the median cubital vein, which is the most common vein you use to draw blood. The most common place you're using always in a patient for drawing blood is going to be the median cubital vein. Then again, you have for the upper limb two systems. One is deeper, the other is superficial. The deeper one, you have the same names you have for arteries. Then you have radial artery, ulnar artery, brachial artery, and you have radial vein, ulnar vein, brachial vein, and you have axillary vein and subclavian vein. But you have an important here superficial system, and that system is cephalic vein all the way up, basilic vein all the way up until draining in the axillary vein, and then you have the connection between both systems is the median cubital vein, which is the vein where you draw most often drawing blood from the upper limbs. Now, guys, we need to get the blood back from the thorax, ribs, intercostal muscles, back to your heart again. Then we're using these veins. Then we have every single rib has an intercostal vein. It could be anterior or posterior. Then they're draining, all of them are draining in azygos veins. And finally, azygos veins, they're going to be draining on your superior vena cava. Besides the azygos veins draining from the ribs, we're going to have these two big guys, subclavian veins. And remember, on the left side, you have subclavian vein, and the right side, you have the brachiocephalic vein. Guys, I would like to do a special mention of the abdomen. Why? Because you have something here which is different, and I'm going to show you why. Normally, in your body, you have an artery taking blood to your body, to your organ. For example, the stomach, you have the gastric artery. The spleen, you have the splenic artery. The small intestine, you have the superior mesenteric artery. Your kidneys, you have your renal arteries. But every single organ in your abdomen is using a filter system. And that filter is called portal vein. This portal vein is going to be a filter after the organs. Then you're receiving from your stomach, from your spleen, from your guts, you're receiving deoxygenated blood again, and you're going to filter through the liver. Because if you receive any drugs, any toxins, any food that you receive, you need to metabolize through the first pass through the liver, and this is called portal system. We have only three portal systems. One is in our head, it's in our hypophysis. The second one is in our kidneys, and we're able to filter that blood in order to produce urine. And then we have a third and most important filter in our body, which is the metabolic filter, and it's the liver filter. Then we use, for these three filters, we use the portal veins. Again, we're filtering after the capillaries are taking the dirty blood, deoxygenated blood. We're filtering again that blood before distributing the whole blood into the body. Then for that reason, we have some veins going through the liver and then draining back to the inferior vena cava. I would like to mention something different here for our kidneys. I have no kidneys here, but I'm going to show you later, maybe. Guys, it's important. You need to know every single organ in your abdomen is going to be draining your blood first to your liver. This is called first pass. This is the portal system. And then you're going to return that blood back to the inferior vena cava. As you already know, the inferior vena cava is going to be going up to the heart, to the right atrium. Finally, guys, we're going to talk about the lower limbs. Then I need you to remember some specific things. First of all, we have, again, two systems. One is going to be superficial, and the other one is going to be deep. Then the deep one is going to be easier. Why? Because you have, again, tibial veins, fibular veins, and then you have the femoral veins, and you're going to be draining directly on the common iliac vein. But you have a superficial system, which is very useful clinically, because we have the longest vein we have in our body, and it's from the foot until you get the internal iliac vein. And this is the great saphenous vein. This is the vein that we use in order to access our veins in our lower limb. This is the vein that we use in order to treat some problems in our legs. This is the vein we use in order to get access into our heart. All of these are important veins, but the great saphenous vein is the superficial one, and it's the longest vein we have in our body. Then, again, you need to remember the deep system. It's going to be the same thing, same names you have in your arteries. It's going to be the common iliac artery. You have the common iliac vein. It's going to be the external iliac and internal iliac. You're going to have external and internal iliac veins. You're going to have femoral artery. You're going to have femoral vein. You're going to have tibial arteries, anterior and posterior. You're going to have anterior and posterior tibial veins. You're going to have fibular arteries. You're going to have fibular veins. But for the superficial one, which is the longest one, is very important clinically. It's going to be the great saphenous vein. It's going to be draining directly on the external iliac vein and the femoral veins. Guys, this is going to be the final part. Remember, you need to remember the great vessels. You need to remember, I know it could be a little bit overwhelming because you have a lot of names here, but we need to remember these names, specifically the bigger names for each section of your body. For the head, the Circle of Willis, you need to remember that. You need to remember the specific branches of the aorta. You need to remember all of great vessels here around the heart. You need to remember the thoracic branches of the aorta. You need to remember the abdominal branches of the aorta. You need to remember the system, deep and superficials, getting back the blood from the legs and hands to back to the heart. You need to remember both systems, superficial and deep. I'm going to stop sharing with you guys my screen. I'm going to stop recording the session because this is the end. And I would like to know, guys, if you have any